welcome to Arrowhead, and it's really fitting for us all to be here today because it's been a sprint to get here. In August of 2011, we kicked off our commitment to childhood obesity here at Arrowhead Stadium by announcing our partnership here and sponsorship of the Sports Lab. And I think most of you guys have had an opportunity to walk through the Sports Lab. And I'm going to actually steal at my peril here one of Anthony's talking points by noting that since that time, we've had about 22,000 kids throughout our metro area come through this Sports Lab. Thank you, sir. So that's pretty impressive in just about 18 months. Now, in September, Blue KC announced its broader commitment to childhood obesity here at Arrowhead Stadium. And at that time, we did not only announce our commitment with the Chiefs, but we also announced a few programs that we also had underway at that time, including our partnership with the YMCA. But I need to take you back just a little bit because about 6 months before that, and I'm going to give you a little window into my life at Blue KC here, but our President and Chief Executive Officer, David Gentile, who's my boss, came into my office one day and said, you know what, Wayne, I really want to do something a little different here at Blue KC, and as in my tenure here as Chief Executive, and at that time, I believe he was in the role for just about 18 months. And this is how David operates, right? So David says to me, you know what, Wayne, we've got a lot of activities going on inside of our company. We've got all kinds of efforts and energy being exerted in a variety of different directions, all focused on health and wellness. My vision for Blue KC is to become the leader in our market as the health and wellness organization where people can come to and have a clear understanding that this is the resource for the community on health and wellness. The way we're doing business right now, it's not clear, and I want it to be clear. I said, okay, boss, what do you want me to do? He said, why don't you get all the folks involved in the different activities that we're doing together, understand where the overlap is, and then define a specific strategy for how we can pool that energy and focus it in a single direction. I said, okay, I can do that. So I went about the business of pulling those individuals together and then listened for a while. And it was pretty clear that we were all pretty much doing similar work, and we all had similar motives. We just needed an umbrella to put it under. So in visiting with our tremendous folks at Blue KC and then doing a little bit of research on what our insured population's health status was, it was pretty clear that obesity in general, but childhood obesity in specific, was really the bullseye for how we should think about moving forward. So that's what we decided to do. And then I put together a quick PowerPoint, which is how we do things at Blue. You know, we do PowerPoints. And I called it, Health Promotion Framework, Integrated Planning and Execution for Meaningful Impact. And I think Donovan's really going to talk a lot about meaningful impact as we go today. So presented it to our executive team, and everybody said, go, go, go. And those words haunt Donovan to this day. Because 18 months later, we're here with you doing just a few things. One, we're going to walk you through the highlights of what we've been able to accomplish together over the last 18 months. And I think Donovan is going to give you a nice preview of a report that will be published around April 25th that summarizes those efforts. And then I think we're also going to have everyone who we've partnered with to really do what we call a 2-minute drill. It's kind of a play on the game that we have in the Sports Lab to really talk with some specificity about your efforts, the work you're doing with us, the work you're doing independent of us in the community all focused on childhood obesity. So I really look forward to that. The other objective that we have for today is for everyone to network, get to know each other, get to really learn what we're all doing, and then hopefully that can spark more collaboration, more partnerships, and of course focusing, as we like to talk about at Blue KC, on meaningful impact, which really is the goal. I'll just quickly mention that the last thing David mentioned to me on his way out of his office was, you know, Wayne, when I say I want to have meaningful impact, I mean it. And I said, okay. And then I scratched my head for a little while, and then I said, you know what, I need to recruit somebody to get this job done. And I was fortunate to find Donovan Davis, who's an outstanding leader in this area. And not just because she's got deep intellect and knowledge and awareness of this topic, but because Donovan is a collaborator. And she fully understands the importance of engaging resources within the community to focus on a single purpose. And that's a purpose that we all share. So she'll have her chance to walk through the accomplishments that we've seen over this year, and then we'll give you guys an opportunity to do the same. So that's my thank you to Donovan for deciding to come to Kansas City from Chicago. But I also want to quickly thank Nicole Williams, who's the program specialist at Blue KC, works with Donovan. Erica Kelly, who's a research analyst, who is crunching the numbers to demonstrate whether we have meaningful impact or not. And, of course, Anita Powell, who is our clinical manager, and she keeps us focused on ensuring that we have clinical closure, which is another term that we bout around at Blue KC. So I think my job is done. Anthony, are you here to do the handoff? Come on, man, you're up. All right. I didn't fumble, did I?
No.
All right, good.
Job.
Thank you, sir.
You signed for the next 3 years. How are we doing today? Good. First of all, I'd like to thank everybody for allowing me to be here. I met Donovan, right? I met Donovan at a wine tasting. She only had about a few, so she didn't have very many. And we just talked about her ties in Chicago and what Kansas City represents now that she's here. Kansas City is a very special place. It's a reason why I decided to stay. There's a reason why a lot of former players decided to stay here in Kansas City. I like to talk in terms of football. You guys don't understand. Football was my father, was my brother, was my best friend. And so work with me. Childhood obesity is a problem. And since 1970, the percentage of overweight children has tripled. Today, 1 in every 3 children is overweight or obese. As Coach Marty Schottenheimer would say, he would put the Denver Broncos on the board. He said, that is our goal. We beat the Denver Broncos, then we get closer to our goal. Well, today, I put childhood obesity on the board. Today, our goal is to fight childhood obesity. What childhood obesity don't know is that they have a offense. The offense is the National Football League. The National Football League has started Play 60. If you guys have not experienced Play 60, you're doing yourself a disservice because there's a kid in all of us, and we need to go out and play with our children and play with our neighborhood kids. Just get them out and playing. I personally had an experience, or should I say 10 experiences with Play 60 because I'm still a big kid, okay? I'm a big kid at heart as well. But it's a great opportunity to go outside and play, and the NFL has done a wonderful job with that. Next, we have a great defense in the local level. Look at this place here, Lamar Hunt and the Kansas City Chiefs. I'm back there now, and I know I had some cereal and other things this morning. Had I known what I was digesting, I probably wouldn't have had the other stuff. All right? So this is a very good, interesting, fun time for kids and people like myself to learn what goes into our bodies and how our body work. So we got a great defense. And last but not least, special teams. That is you. Blue KC, without a team, nothing is achievable. And with your help, with the NFL, what Lamar Hunt and what he stands for, and what the Kansas City Chiefs stand for. Childhood obesity, look out. We got our team, we got our goal. Now, like you just said with the rest of us, now we just got to execute. We can do it, and we will do it, right? Or if not, I will be back. I will bring my linebacker skills out and dust them off. But we got a team now, and now we just have to execute, and the challenge is ahead of us, but what would life be without a challenge? And so it's good to be here with everybody today. They gave me 5 minutes to speak, but also the partners. It takes family members. We all give up something to be here. We all give up something to be a part of something great. But one thing that we have to understand, we have to give back to our community. Without our community, we are nothing. Without the Chiefs fans, the football players are nothing. So we are one goal, one heartbeat. Together we will succeed, and childhood obesity will fail. Again, thank you very much for having me here today. Thank you.
I'd first like to welcome you again to this event. It's wonderful to see all of our partners and friends here this evening. I want to thank Wayne and Anthony for that wonderful open remarks. And I just wanted to spend a little bit of time, as Wayne mentioned, the focus of the work that we do at Blue KC really is about partnering with organizations to help serve as a catalyst and accelerator for the important work that we're all committed to doing as we address this issue of childhood obesity here locally. So I won't belabor this. I think we all know in this room that childhood obesity is a local and national epidemic. When you look at the national statistics, they're clearly alarming, and I think that's why we're all here committed to doing this work. What's really also interesting is that if you project out to 2036, you'll see that at present, we're at about 18% of our children are obese, but by 2036, that will almost double if we can't get a handle on this issue. When you look locally, we echo national statistics. We're about a third of our children or youth in the Kansas City, both in Missouri and Kansas, are obese or overweight. And then when you drill down specifically to certain subgroups, you see that there is a greater prevalence of this condition, particularly school-aged children of low income. So I think that we know that there are many comorbid conditions that are associated with childhood obesity, and so there's clearly a human cost to this issue, and an imperative, I think, to make sure that we are preventing and actively and effectively treating this condition. But there's also healthcare related costs, and we know that millions of dollars, over 14 million billions of dollars, are spent annually on direct medical costs associated with childhood obesity, and a normal weight or overweight or obese child is 3 times more costly than a normal weight child. So there are both human and direct healthcare costs associated with this condition. So at Blue KC, health promotions was really, as mentioned by Wayne, go, go, go. I have PTSD every time I hear those words. But anyway, was really charged to develop a comprehensive framework that was based on a public health model, an ecological model that says if we want to intervene and impact childhood obesity, we need to target multiple levels of influence, from individuals all the way to environmental and policy change. And so what I think is nice about the representation here today is that we all are working on a variety of different pieces and components to this work. So when we look at Blue KC's programming, we have three main focused areas. Sometimes people ask us, are you just worried about your members, if you will? And I said, absolutely not. Health promotions in particular at Blue KC is more community centric. And so we are working to address these issues both for our members, but also for the greater Kansas City community. We also want to focus on meaningful, as you heard, and impactful work, and being very systematic about our evaluation of our program. And using the information we gather through multiple qualitative, quantitative methods to figure out what's working and how we might use that information to inform our future programming and partnerships. When we think about some of the key tenets of what we want to accomplish with all of you, it's really to several things. We want to, again, I think, leverage all of our unique strengths and assets to be able to enter in partnership around this collective mission to address childhood obesity. We also, again, want to be based on a public health framework, and so a lot of the work that I mentioned is focused on more of a public health model from that ecological perspective. I think why we're all here too is that we want to contribute to the local knowledge and evidence base, and so that we can collectively address this issue and then inform what we do to help accelerate large-scale efforts here locally and also inform national efforts as well. And again, from our perspective at Blue KC, we want to be able to use primary or the data that we gather as well as secondary and other data to help inform our direction and our purpose and our programming. And so we've done quite a bit of this over the last several months to be able to communicate what we're doing, how we're doing it, and the impact of all of the work that you're involved in with us. So I won't take still the thunder of the 2-minute drills, but I just wanted to say, when we think about the ecological framework and we look at the programs that we have currently underway, so when we look at the individual focus, the individual tier within that model, we have several initiatives. The Chief Sports Lab, we've been able to partner with other professional teams that really help to accelerate people's knowledge and awareness, but also equip families with tools and resources to be able to improve their lifestyles and their behaviors. When you also look at education and behavior change within that individual level, we have Girls on the Run, which we'll talk about before, but really focused on driving increased education among targeted groups related to healthy lifestyle and healthy living. And then the Arts of Healthy Lifestyles, where it's the integration of arts and health education to really increase knowledge and awareness around these issues with school-age children, since we know they are disproportionately affected by the condition. We also have several programming that I think we are trying to then focus on individual, community, family, as well as clinical outcomes change within this area. So some of our work, like MEND, is a clinical behavioral intervention that really focuses on kids that are already overweight and obese and trying to work with them and their families to modify behaviors. And there's clear tracking of not just knowledge and behaviors, but also clinical outcomes. And so we really try to represent a broad array of programming that cuts across both awareness and education all the way to clinical outcomes tracking and modification. And last but not least, I always say I'm a strong proponent, and if environment and policy doesn't support individual behavior change, we're not going to see the significant differences in choices around these lifestyles. And so we are working with several partners, all of, I think, are here today, to focus on environmental changes, whether that's focusing on the issues of play deserts and how we increase play opportunities for youth and families in the urban core, all the way to communities and how we build our communities to support healthy lifestyle and more active living. So when you look at 2012 REACH, what were we able, along with you all, to accomplish in 2012? And I just want to bring forth some highlights. First, we were able to work with almost 80 schools in the greater metro area, more than 11,000 youth in 2012. Across 16 school districts. And why that's important for Blue KC is that we have 18 member school districts that are our member districts. So we were able to work with many of those through the work this year, and will continue to do so. We also had a evaluation tool that we used, and it cuts across all of our programming, and that's our Healthy Family Survey. And that was developed in collaboration with KU as well as Iowa State. And we actually have both a paper and online version of this tool, and we also use that across our programmings to measure outcome and impact of what we do. And so just in 2012, we were able to engage nearly over 8,000 families through this Healthy Family Survey. So who's participating in our programs? And I think it's important just to say we have a pretty good diverse group of families participating in our programs at present. About 51% of our youth are Caucasian, 43% I think that says, African American, 6% Hispanic, and then when you look at ethnicity, we are majority non-Hispanic, but we do have a good representation of Hispanic families. And then when you look at child gender and parent gender, we're pretty evenly distributed in girls and boys that participate in our programs, which is great. And I think indicative of most programs, we have more mothers or female care providers participating in our program. When we looked at Blue KC membership, so how many of our participants are Blue KC members, it is about 20 or so percent. And that makes sense because our focus is more community at large and not just specific to our members. So when you look at weight status across our programs, we actually have, for at least 2012, most of our participants are of normal weight. However, we do have, when you look at the child participants, about 25% or so are obese or overweight, so a little bit lower than population rates. But what's also very interesting is that nearly 70% of our parents are obese or overweight. When you parcel this out by the race of the participants, so again, most of our participants, independent of their race, are normal weight, but there is a significant difference between the proportion of African American and Hispanic children and families that are, or youth that are overweight or obese compared to our Caucasian families. So I wanted to just present this because you've seen the graph to your left before. It's just the geographic reach of our programs. But then we thought it might be interesting to graph the density of weight status across by zip code of zip code of our participants, with the red areas being higher density of overweight or obesity across our participant population. And I like to highlight this because oftentimes we think that it's just an urban core problem. But if you look at our participant population and where they live and the density of prevalence of overweight, you see that it reaches across a large geographic area, and actually is not just a urban problem, but also a rural problem, which I'm sure all of you all are aware of. So I just wanted to take a little bit of time. Our Healthy Family Survey, again, I encourage you all to go out to our website and look at the survey, but that's really one of our evaluation tools. And so when we crunched the numbers and said, okay, when we look at our participant population, what do they look like as far as these scores? And in general, what it's telling us that if overweight and obese children or parents are scoring significantly lower on the Healthy Family Survey than normal weight and overweight. I don't know if it's rocket science, because some of the tool actually assesses behaviors related to physical activity and nutrition and dietary practices, as well as self-esteem and some affect measures like depression. So briefly, just want to drill down a little bit and highlight some of the work. When you all, because I know you all will, go to our website on the 25th of April and download our report, you'll see more aggregate information. But I thought it might be important, as we have all of our partners here, to kind of drill down so people know what work has been done in certain areas. So our Chief Sports Lab, I think, Wayne mentioned 22,000 youth have gone through the labs since 2011, but I wanted to highlight some 2012 statistics. So we were able to support 58 or so schools. Over 7,000 kids actually went through last year. And then 72% of which filled out our Healthy Family Survey. So that's a really pretty impressive response rate. And then we learned, again, that, overweight and obese scored lower. And then there was at least some uptake in knowledge about recommendations related to physical activity and nutrition. Girls on the Run, we were able to support 15 sites, over 400 girls, very high retention rate for that program, and about over 50% response rate, so still very respectable for community-based programming. We saw that there was at least some self-reported increased engagement of physical activity as a family, decreased junk food consumption, and increased self-esteem. And then wanted to highlight Kaboom. And again, Zoe, I know you're here, so I don't want to talk extensively about it, but we were able to partner with Kaboom to address play desert concern here in Kansas City. This was really a collaborative effort. Multiple community-based organizations. We partner with the Housing Authority to build this playground so that 800 plus kids would have access to play opportunities. And so really kind of speaks to trying to do some community transformation efforts and environmental change efforts as well. And then our folks at Kansas City B-Cycle are here. And so we are very fortunate to be able to partner with Bike Walk KC to introduce a bike share system here in Kansas City. It's a healthy option. It's an affordable option. And we really want to continue to support their efforts. And they were pretty successful last year, and we want to continue to see that number grow. So over 7,000 rides were conducted in just a brief period from July to October of 2012. And then last but not least, about the clinical focus that I mentioned, we were able to partner with KU Medical Center to do a brief clinical pilot where we were testing the effectiveness of group telephonic weight management coaching for a small sample, and it yielded pretty promising results. And that's important because as we think about several different strategies and approaches to reach our families and to engage our families in weight management, it appears that telephonic, working with groups and families telephonically is one viable option. So I'd like to end with thanking everyone again for being here. We couldn't do this alone. We have no goal to try to do it alone, and that's why all of the work that you're doing is critically important to the mission of addressing this epidemic. I'd like to now just tell you, I encourage you all on the 25th to go out again, learn more about our first edition of the report that will really focus on looking at childhood obesity from a national and local lens. It will talk about some of the programming here more broadly that I've highlighted, but also be able to report some of the data that we're able to gather related to this work as well. And also, finally, it will highlight call to action. So we don't want to just tell, our stakeholders about the problem. We want to equip them with strategies to be able to collectively address it. So with that, I say thank you. I'd open it up. Any questions, comments? Okay. And I would encourage you all, if you haven't done so, we have a postcard as well as an executive summary of the report. And I also encourage you, if you haven't done so, to sign the sign-in sheet so that we can also mail you a copy of the report as well.
We are just really excited to be here. We just can't express how grateful we are for our partnership with Blue KC and what they've been able to do for our girls in this community. Let me tell you a little bit about Girls on the Run, just so you know what we do, and then I brought something special to read. What Girls on the Run does is Girls on the Run helps girls take charge of their lives and define the future on their terms. You can also think of it as Can University, a place where girls learn that they can. When asked what Girls on the Run was all about, one of our participants put it this way: I learned that I am the boss of my brain. And some of us, yes, some of us in our 40s could learn that as well. So we teach the girls that there are no limits, no constraints, nothing stopping them from being remarkable girls. We start, our program is a three-pronged program, so the first third of our program starts with helping the girls get a better understanding of who they are and what's important to them. So talking about them and maybe asking them about what's important to them and what dreams and goals they have. And I will tell you that some of these girls have never been asked that before and never been asked to even think about having a goal. So it's pretty exciting to see that first part and just how they open up and realize that this is a place where they can start to talk about things in the future. The second part is the role of teams and healthy relationships. So a typical Girl on the Run team is about 15 girls, and this is the part of the program where we start to break them down, and we start to break down those cliques and what they think others are about, and we start to build up their team. And we do this in really fun and unique ways. The third part is how they can shape the world. So we ask them to look in about themselves, look at their team, and then look at the world around them. The unique part of our program is that we incorporate running into our curriculum. So we use this activity to inspire the girls, to motivate them through our 10-week program, but also to encourage lifelong healthy habits and fitness levels. They are not running. We don't ask them to run a mile. They are playing games. They are building their team, and they are running together, which is a pretty powerful thing. At the end of the season, at the end of the 10 weeks, all of the girls across the community come together for a big 5K event. It is pink and green galore. You will not go to another 5K race that does this. The girls get their hair done beforehand. They get it spray painted pink and green if they like. So we tell them it's the only time they'll ever run a 5K but get their hair done first. And it's very fun. But the point of that is that we want to celebrate these girls and their accomplishment, and they're learning to do something that they may have never thought that they could do before. And I will tell you, if you want to see the impact of Blue KC on this community of girls, then you come out and stand at that finish line and hand out those medals to those girls who never thought that they could ever run a 5K race, and watch them come across that finish line with tears in their eyes, and realize what kind of gift that Blue KC has given these girls. So we just, again, we can't express it. I can't express it, but I know someone who can. I brought a thank you letter that happened to come to me for Blue KC this week, and I thought it would be a good thing to end and to read on. Dear Blue Cross and Blue Shield, thank you for letting me be on this team. It has really changed my life a lot. I feel like I can do anything, and I know I can do anything now because of you. I have friends here on this team, and this all happened because of you. Thank you very much. A confident girl named Avila. So thank you again.
Good evening, everyone. I'm Martin English. I'm the Executive Director for Kansas City Young Audiences, and I too am learning to become the boss of my own brain. Kansas City Young Audiences is a nonprofit arts education organization. We've been around for 52 years serving children and youth in the Kansas City metropolitan area. Our mission is to engage all youth in the arts, promote creativity, and inspire success in education. And we work with about 200 teaching artists that we send out into the schools, libraries, community centers, and they will do workshops, performances, and residencies in all of the arts disciplines. Last year we served about 130,000 students around the KC metro area. So we were thrilled to partner with Blue KC on an exciting new project which we're just beginning. It's called The Art of Healthy Lifestyles. And we have created arts programs from the ground up that have healthy lifestyle and obesity prevention themes. We're piloting these programs right now in two schools, Hope Academy and Blue River. And some of our talented teaching artists are here today, if you would just wave. We thank them for their efforts in building this really from the ground up and creating these workshops and things. The project starts with a performance for all of the kindergarten, first grade, and second grade students in a single school building, and that's done by Dino Odell. And it is a music performance, and then all of the kindergartners and first graders get a follow-up workshop in a little bit smaller group, and that's a theater workshop. The second graders get a follow-up movement workshop, and then finally, all of the second graders get a 10 to 13-week residency where they're building and learning all of these themes, and at the end they get a chance to perform what they've learned. So the students are learning what we call sort of the 5, 4, 3, 2, 1 basics of healthy lifestyles, among many other things. So they're learning that they need at least 5 servings of fruits and vegetables every day. And to help them avoid sodas and sugary drinks, we're asking them to have at least 4 glasses of water every day, 3 glasses of plain white milk every day. We ask them to have no more than 2 hours of screen time every day, and they have to have at least 1 hour of vigorous physical activity every day, 5, 4, 3, 2, 1. By the way, this works with adults too. So the project will engage students in highly active arts activities and creative play. It'll allow them to gain knowledge and healthy lifestyle choices, which we hope that then they'll take home and exercise in their homes. And it gives the second graders a great opportunity to demonstrate what they've learned by sharing it with their peers, the kindergartners and the first graders and their families at the end of the project. I got to say, we're really excited about this partnership with Blue KC. Our goal is to provide this programming in the fall to all kindergarten through second graders in the Grandview School District coming up. And I got to say, I'm a little even more pumped today because when Anthony Davis says you're part of their special teams, you got to believe it. So, thank you.
Hi, I am Malia Halsey. I'm the MEN coordinator for the Independent School District. I feel like I probably have one of the best jobs because I get to see our families from the very, very beginning of this 10-week program all the way until the graduation. So I see their progress, I see their motivation, and I see their change. First, I want to just start out by thanking Blue Cross and Blue Shield for the funding for this program. It has made this entire program free of charge to all of our families. So it's a great experience for them. They're able to really come in and just be a part of something great. The other people I want to thank really quickly are the YMCA, and I want to point out Brittany. She handles all of our post-programming. The YMCA has been a fantastic partner with us as well. They give us the exercise leader, and then they also offer all of our graduate families a free 3-month membership to one of their facilities. So it's a great partnership to have, and I really hope that through all of your community health and wellness programs that everybody is or has the opportunity to have a partnership like we have with YMCA and Blue Cross and Blue Shield, because it's so meaningful and you really feel like part of a community. What I want to talk about is our program. It stands for Mind, Exercise, Nutrition, Do It. It is a 10-week program for our students between the ages of 7 through 13 who are above a healthy weight and their families. We really focus on this as a family-based program. We are in the first year of piloting a school-based model, and we are so excited about it. MEND helps families change unhealthy attitudes about food and activity, keep physically active on a regular basis, learn how to choose foods that are healthy, tasty, nutritious, and take action to maintain that healthy weight. That's the do it part. We'll give you all the tools. Now it's when that 10 weeks is up, you go out and do it. Some of the really neat things that we do with them, we take them on a grocery store tour and teach them, and they get to use the skills that they've learned throughout the 10 weeks in real life. Okay, so you've taught me how to do this. What am I actually supposed to do? Well, let's go to a grocery store and you'll see. So they get to create a grocery list right there. We also do a big graduation celebration at the end of the 10 weeks. So they, not only just the kids, but the parents, you can see the excitement in their face when they're handed that diploma. You can see the excitement that they realize, I've done this, I've committed myself to 10 weeks, and I feel better for doing it. Just real quick, before I give my final thank you, I want to just share one family's kind of experience. Ate very unhealthy, always rushing around. Dad worked 2 jobs, mom worked a job. After going through the 10-week program, they've really focused on changing their eating habits and making dinner time a priority. When Dad has to work his second job, he stops, comes to dinner, and maybe it is only half hour, 45 minutes, but they have that family time. They do things as a family now. They're active as a family. They shop as a family, and sitting down at mealtime together, it really just keeps that bond complete. So I just want to say thank you very much.
Hi, I'm Eric Rogers with Bike Walk KC and Kansas City B-Cycle. We started off probably about 2 years ago, I think it was, Ty, looking at what it was going to take to really impact Kansas City. Unfortunately, we're in the situation where our rates of walking and bicycling are less than half the national average, which is linked really tightly to a lot of the statistics we've seen about the health of our community. And one of the ideas we came up with was this idea of bike share, which was really taking off in a few other cities in the U.S. and then in several other cities elsewhere. And as we were looking around at partners to help us bring this idea to reality, Blue KC really stepped in and instantly understood why it was important to the community, to the health of the community, and why it was something that Kansas City really needed to figure out and get done. And we did that very quickly last year. It was really a sprint, and we crossed the finish line on July 3rd, one of the hottest days in the history of Missouri or Kansas. But we had an amazing rollout event. We got all of the bikes out onto the streets of Kansas City. The 12 stations are on the ground throughout the greater downtown area. So just briefly, for those of you that aren't familiar with the program, it's really like Redbox, but for bikes. So it's a self-service system. You can go to any of the stations, swipe your card, the bike unlocks magically. You can take it, wherever you need to go, and then drop it off at any other station. We're seeing a lot of really cool usage patterns in terms of folks going out on a ride to lunch where they might have stayed and had lunch at their desk, but now they're riding down to the city market or to the crossroads for lunch. A lot of folks are combining a trip to the farmer's market on Saturday morning with a bike ride. We're seeing a lot of folks going out on rides with friends, family, parents, whatnot. It's really a really cool way to see the city and have a good time while also getting some good exercise, getting some recreation, getting some fresh air. We had some really good statistics in our first 5-month season, just within a short amount of time. We burned over 500,000 calories between about 2,000 people who used the system. So we think we're starting to have a really good impact, and we're excited for our full season this year to really look at all of that information. We did a brief customer survey a couple months ago and found that there's some really good data around folks that say they are more active now that they've tried bike share. They're biking more. They're more likely to maybe purchase a bike if they haven't owned one before. And then people are reporting higher outcomes in terms of elevated mood, weight loss, more physical activity. And so we think that we're still very new, but we're really encouraged, and we're really encouraged by the support of Blue KC. We've already seen a lot of impact in terms of how this is going to impact the built environment and the city. We were unique in that we were one of the cities that started up a bike share system without any public money to start up with. And we were able to still have a really good impact on the city. City of Kansas City has really stepped up to the challenge to start building the bike lanes and the trails and the facilities that are not only going to connect the bike share stations, but also provide new amenities for everybody who might be biking in Kansas City. They just recently received a federal grant that's going to allow them to add about 12 miles of bike lanes in the downtown area. So bike share was really a catalyst to get that funding and to get support among the elected leaders and the policymakers in the city to make that change happen. So that's kind of us in a nutshell. We'd like to thank everybody at Blue KC for all of your hard work. We know everybody put in a lot of work to help us get where we are, and we appreciate that. And we look forward to this year. And I encourage everybody to come out and try the system.
Good afternoon. I'm Beth Lowe. I am with KC Healthy Kids, and I want to start by thanking Donovan. We are doing policy work, as she noted during her presentation, and oftentimes it's challenging to find funders who understand the nature of policy work, why it's so relevant and important, and how it complements programming and community-based work. Donovan got it right away and has been a delight to work with, so thank you so much. KC Healthy Kids is focused on reducing childhood obesity by working with communities to identify ways in which we can support healthy eating and active living through policy and environmental change. And we have a couple of ways that we do that, ways in which we engage the community in identifying those solutions, and then with help from Blue KC, we're able to do some of that policy work. The ways that we engage communities include the Healthy Kids Initiative, which is funded by the Robert Wood Johnson Foundation. And we have several communities throughout the metro, both sides of state line, where we work within communities with staff who are based in the communities to develop programming based around the neighborhood's identified needs and desires for supporting healthy eating and active living. One of the ways that many of the communities we're working with have chosen to engage on HEAL has been community gardening and urban farming. Many communities which are experiencing food desert issues also have a high density of vacant lots, which on the bright side means there is a lot of arable land for food cultivation, and gardening is great physical activity, as well as providing you with, at the end, barring a drought, some really great food. Speaking of drought, one of the things that we have seen in many of these community gardens in the last year are challenges due to the drought and lack of water access on vacant lots. If there's drought and there's no water access on a vacant lot, or maybe you've got a community garden or a farm that's on several vacant lots, your harvest can go from bounty to bummer pretty quickly. And installing water access is very expensive. It can cost thousands of dollars. And so one of the ways that KC Healthy Kids moves from supporting the community-based solutions and programming to policy work is right there. It's water access. So we're working with local governments to identify strategies for helping community gardens and urban farmers reduce the cost of installing water access and reduce the ongoing cost of making use of that water once it's installed. And so that's a great example of the sort of work that we're doing and that is supported by Blue KC. Another way in which we engage the community is the Greater Kansas City Food Policy Coalition. And the Food Policy Coalition is really broad coalition. We're in the midst of an ongoing effort to engage with grocery store and grocery industry representatives to identify policies which, if changed or created, would allow them to develop or renovate and maintain affordable, high-quality, healthy food retail within underserved areas of our community. And that's policy change too. Too often we forget that policy isn't just about public policy, it's also about institutional policy. And so the support of Blue KC has been incredibly important, and we're very grateful. Thank you.
My name is Jared with the Kansas City Chiefs. I have more respect for everyone else in this room than I do for, let's say, having a sports organization. Obviously, you guys are much more focused, and we appreciate all that you do in the community. As a member of the Kansas City Chiefs, we have a tremendous advantage because we have the eye of the world on us, whether that's good or bad and being hooked up to the TV or whatever it is. But what it is that we have this advantage that people are paying attention to us. Because of that, it's our duty to take that attention and to use it in a good way. And that's what the Hunt family has done here. As you may have noticed, for those that have been in Kansas City for some time, there's been some renovations done to the stadium since pre-2010. What happened in these renovations is that the Hunt family looked at opportunities, how they can make a difference in their community. They identified the sports lab here as an opportunity to help fight childhood obesity in what is an epidemic nationwide. So in doing this, we've had a terrific partner in Blue Cross and Blue Shield of Kansas City to help us target schools in the area and to make it better. What Blue KC specifically has helped us do is that we've reached out to schools that would otherwise be unable to come out here, to be unable to fund trips to the sports lab, to come out and see what is a great example of a textbook that's come to life. And so to be able to teach in a different way, it's a wonderful thing to be able to do. And just 7,000 kids this past year were able to do that because of Blue KC. On top of that, we do 365 days of tours here with 80 kids coming in at once. That's half of the group, multiple tours a day. Really, we try to program this place as much as we can to give the impact that it should to Kansas City. Our attendance from 2011 to 2012 has increased by 89%. It's something that we've just only begun really to find the part of the iceberg that really needs to happen here to get to the larger community. And so we are excited about what's to come. It's great in knowing that we have a terrific partner on board with us, and we'd love to know how we can help serve you guys as well with this. One thing we've developed in the past year is we understand that it's difficult to afford a bus and coming out here to Arrowhead Stadium, which is not conveniently located downtown or anything of the sort, but to be able to bring the sports lab to them. And so we've made a traveling sports lab, basically, which come in luggage cases, basically, that they can go out to the schools and we can interact with them there. And so it can be something convenient to them, which is still a way to be this visual textbook that we have. So we are very privileged to be in the position we are. We are happy to be a part of this program, and I thank you all for doing what you can to fight this epidemic.
I'm Deborah Markinson. I'm with the Weighing In program at Children's Mercy Hospital, and we value our partnership with the Blues over the years and some future initiatives that we look forward to. In terms of some of the strategies that we focus on, it is clearly the collaboration. So we welcome this opportunity to celebrate with all of our key partners in this room because we have a similar common ground in terms of the areas that we're focused on. I will leave some brochures that outline some of the key tracks that we are focused on. We would love to enhance healthy pregnancies, healthy weight gain during pregnancy. We also have a group that's focused on early childhood. We've recently completed a survey of child care facilities, looking at what are they feeding the kids, what are the practices to enhance those environments. We also have a Healthy Schools Committee that's focused on improving school wellness policies, and we've recently completed a comprehensive assessment. So I have an executive summary funded by the Healthcare Foundation, and we would love for anybody to pick up a copy of that because that's an important setting for our kids. Another track that we're working on our Healthy Lifestyle Initiative, and that's focused on how can we get everybody on the same message, as well as early intervention and detection of the problems. And so we're working with our primary care clinics at Children's Mercy to figure that out, and we'll love to look at other opportunities to spread that early detection and those early prevention strategies from a primary care perspective, because all of our kids, 95% of them are seeing a pediatrician or a primary care provider, so it's a rich opportunity to spread the message. And then the last group that we're working on is that treatment aspect, because we've got more knowledge and information about what works, and so we welcome opportunities to collaborate on those strategies. So thank you, Donovan. I agree with Beth, you get it. And you and Nicole have done a fine job of helping to move this issue forward within our community.
Hello, I'm Zoe Pagley from Kaboom, and I'm thrilled to be here. We really value working with Blue KC, and what I'd like to do is tell you a little bit about our organization and then close with a video which will give you a real visual on our project with Blue KC this past fall. So, Kaboom is a national nonprofit. We have been around for 17 years, and we envision a great place to play within walking distance of every child. And we're really all about active play, and the need for playgrounds are really important nationwide. The statistics are quite remarkable that only 20% of kids are actually within walking distance, and by that, half a mile, their home is half a mile from a playground. And what we see, and why it's directly relevant to the issue of childhood obesity, is that 29% increase of childhood obesity rates in those areas that are not within walking distance of a playground. So that opportunity, that access opportunity, is really important, and we focus on the spaces to play. We've built 2,300 places to play with our business partners nationwide over the years. We're also focused on increasing the time to play, so giving kids an opportunity through advocating for recess, through making playgrounds more appealing. So we have an initiative underway where we're looking at developing more innovative playgrounds. So how can you engage those kids, want them to come back more often? And our approach also works with municipal leaders as well as the businesses that sponsor our playground builds. So with that, I'd like to close with the video which showcases the project that we did together this past fall.
About a year ago, Blue Cross initiated the campaign to take on childhood obesity. Today here at this great location and on this beautiful day, we have, I think, about 250 volunteers who are dedicated to work with Blue KC and Kaboom to build a playground, because in this community about 700 children do not have access to a playground. And at Blue KC we know that when kids have a place to play, they're more active, they're more energized, they learn better, and they hopefully live longer and have healthier lives.
I encourage you all to meet each other, talk. As you all were talking, it sounded like there's some, I think, potential opportunities to come together to even have a more collaborative effort in this work. So thank you again, and I really appreciate you all for joining us today.